In today's fast-paced real estate landscape, success demands more than surface-level expertise. It requires insight, adaptability, proven strategies, discipline, and the ability to take risk. The Agent Brew podcast blends candid conversations with wisdom from industry leaders who've walked the path before you. Think of us as your strategic pit stop to fuel your real estate journey. From the crossroads of the world in the heart of Times Square, welcome to a different kind of episode of the Agent Brew. I'm your host, Eric Zollinger of Realty Co. Don't worry, usually at this point we say it's a podcast that percolates real estate insights. And I promise you we will still percolate insights, just of a different kind. Instead of us focusing on an individual agent's journey, we're going to focus on a very important topic facing all real estate professionals and really any person. And that is the search for healthcare, for health insurance. And today we're going to focus with Realty Health and exploring health insurance options as an independent contractor. We're going to try to demystify the healthcare search for affordable healthcare options that are specifically designed for real estate agents. But as we all know, that really is the category independent contractor. So any entrepreneur that is out there, any gig worker that is out there, this podcast relates to you too. So we welcome everybody to sit down, learn, and hopefully understand a little bit better after today why healthcare is such a frustration and interesting search, right? So we welcome the CEO and founder of the Healthy Business Group, Thomas Morrissey. Welcome, Tom.
Thank you, Eric. I'm really pleased to be here.
So full disclosure, Tom actually is one of our service providers here at Realty Co. for our solo healthcare. And that is part of our Realty Health, as I like to say, our spoke of service. And I have to say, I've just been so blown away by what you have been able to offer and deliver for our agents across the country. Tom, will you tell us first off, what do you do at the Healthy Business Group? What is your role there? And then how did you get there?
Well, let me start, Eric, with how I got here. So,
Okay.
Just a little bit about my career. Back in '85, I started in New York City with Cigna Healthcare. I spent just under 25 years in the employee benefits marketplace, working with employers through brokers and consultants in the 300 to 5,000 employee space, and then national accounts. I had a lot of work in the national accounts area as well. So, 25 years, long time. I would say I had one foot out the door with some ideas about how I could help the smaller employers navigate through this really archaic healthcare insurance system. And probably for about 2 years, it was percolating, and I finally decided to leave. I created Healthy Business Group first to help the smaller employer. And now we've sort of pivoted where this growing population of independent, self-employed individuals, real estate professionals included, needs the most help. These are the folks really that get screwed the most in the healthcare system. It's the self-employed, independent contractor, freelancer, gig worker that really is limited with options they have on the table. So we came in to help solve that problem.
That's great. One of the things that's coming to mind as you're explaining all this, really anyone that is an entrepreneur that is running their business or is a real estate agent, works in the arts, you have a brand, and that brand is your company, and you are the CEO, you are the head of marketing, you're the head of business development for that company, right? So you should be setting yourself up as a company. And when you do that, I guess you're considered then as a small business, technically.
Sure. I mean, if you think about it, every independent contractor is running their own business. Now, whether they've formalized their business with the proper filings and documentation, that's easy. And I know Realty Co can help your constituents do that. So I would argue that every real estate professional out there should be set up properly. And one thing about Solo Health Collective, And we'll talk more about it, I'm sure, but it is important that each member of Solo Health Collective, because it is a business insurance platform, has a federal tax ID number or an EIN in order to get on the plan.
Understood. And so that's why I think it's important. And that was a step that I didn't connect the dots originally to understand how this was even possible because we're all independent contractors. But the moment you say, well, no, it still technically is an employer driven plan because everybody is an employer that is joining. So,
Absolutely.
so Tom, can you please, because I have to admit, I didn't grow up with a lot of information about insurance. I knew it was something that I got through my parents. And then I was a gig worker for a long time, but I was always able to find the little niches where I had healthcare because I ended up being technically an employee, whether it be when I was at Related or I was originally an assistant. There was only 3 times in my life where I had to worry about, oh, I've got to go out and search. But to be honest, the Real Estate Board of New York has their own group plan. So I just went to our benefits person and it was like I was back. I think I had Oxford and it wasn't too difficult. So now I know things are very different. Can you help everybody understand? Basically, let's start at a macro level first. So we won't talk about traditional and non-traditional. We'll hold that for a second. But I guess one could break down plans by an HMO plan, a PPO plan, and then an EPO plan. Is that correct?
Well, those are three different types of networks that are available.
Networks, okay.
Uh, so the carriers, if you will, the insurance companies themselves, we being Solo Health Collective partner with those types of companies, and we offer the multi-plan PHCS national PPO network. That is an open access, no primary care referral needed. The PPO is the most, I would say, liberal in terms of its ability to be used. It's national in scope, so there are no state boundaries. Where other networks like HMOs, we've all heard of HMOs.
Right.
They're typically what are referred to as lock-in, where a given HMO call it New York City would have a lock-in network where all the providers are locked in. They're New York based only. So it really doesn't travel well, if you will. You can always, if you're in an HMO, you can always get emergency care out of your network area. Let's say you're in California on business or you're in Colorado on vacation. If an emergency were to occur and you're in an HMO network, of course you would be covered for that. But then you have to get things taken care of back at home in your network, in your HMO network. So the basic difference between an HMO and a PPO, in my mind, is the liberalization of the network where it's across the country if it's a PPO.
And the flexibility should if you're working multiple markets, that's quite convenient if you're able to see doctors across the country.
Absolutely. It's a key distinction for what we're talking about. HMOs are viable for the real estate professional, but they're not optimal, is what I would say. And that being because of lock-in. And I know a lot of real estate professionals are traveling. You might be doing business in New York, Miami, LA, whatever the case may be. And you want to be able to choose providers in those areas that you can get to know just in case something were to happen. That's a PPO. In an HMO, you can get by, but you are going to need to have your home HMO network. If you're mostly in New York, you would do it here in New York. And then you're really only covered, again, for emergency care while you're traveling.
Got it. Thank you for that distinction. Because we're always trying to be that trusted partner with all of our agents across the country, as well as, just add basic value. Solo Health Collective is not one that I've heard recently. Is this a new company? Is it something that, how secure has it been put together? And is there any concern that one could potentially have with choosing?
Sure. Well, great question. And you haven't heard much of us because we are relatively new. I get that. I think we talked at this time in late 2024. This was basically an idea. We started the business, Solo Health Collective, in late 2023, but we were mostly, call it R&D,
Okay.
development of the platform. throughout the course of the early 24, and we really didn't start writing businesses onto the plan until the second half of 24. In fact, we had 50 or so businesses on the plan before the holidays in 2024. And today
Okay.
I'm proud to say there's well over 600. So there's hundreds, soon to be thousands and tens of thousands in the plan if we execute on our business plan appropriately.
Got it. Well, good luck with that.
And you had mentioned, let me just continue the
Sure.
thought. You had mentioned, reputationally, are we secure? I would tell you that what we've done is very unique in terms of the development of Solo Health Collective. We are partnered with a insurance company called Vault that is the captive insurance carrier. So this is known as a captive insurance play, if you will. And there are many different components. As I mentioned, Vault is the third-party administrator claims payer. They're the originator of the plan. We also have partners like MultiPlan I mentioned before. That's the network that's involved. We use Pharos for pharmacy coverage. Most importantly, though, when it comes down to risk, we are through the Vault program. We are secure in that we have all our stop loss, both aggregate stop losses, which is the umbrella over the entire collective, and specific stop loss, which protects each individual business owner or one of their family members for individual claims that exceed a certain amount. In this case, any claim that exceeds $150,000 that hits the collective, if you will, from one business owner's member, Odyssey Re protects that, where they pick up, we pay them a premium. So a portion of every business owner's premium that's in the collective is portioned off to go to Odyssey Re, which provides the full coverage for any claim exceeding $150,000. Now, in my career, I have seen dozens of claims. I wouldn't say dozens of claims over $1 million, but I've seen dozens of claims under $1 million, but well over 500,000. They happen more frequently today than ever. It could be a premature baby. It could be a really bad accident. But these claims happen. But our members are secure in knowing that through the Vault captive, we're secure with Odyssey Re. Now, Odyssey Re is a Stamford, Connecticut-based reinsurance company that is rated A+ on both Standard & Poor's and Moody's. So very strong capitalized company. And I'm also pleased to say that while we have only been doing Solo Health Collective for, call it two years now in terms of development and market readiness, the captive itself has been around since 2017. So we are a part of that program, and as we gain scale, we will separate from that program into the Solo Health Collective being a meaningful part of what Vault's doing, but standing alone with what we're doing.
Got it. And so all of our clients across the 50 states are eligible to explore this health plan, correct?
That's absolutely right. We operate in all states. I'm pleased to say that on your website, Realty Co, under the healthcare banner, if a prospective member were to look at that site, we are featured there on the left-hand side under major medical plans. There's three links you can go to. We're on the far left. We happen to be given, and I'm proud of this, the most popular for real estate agents banner that you guys created there. And so people can just jump on there. They get a quote from us without giving us any personal information whatsoever. When I say personal, we're not asking for their full email address. We're not asking for their name. They can give us that voluntarily. But if they put in their not de-identified date of birth, zip code, and gender, they're going to get a quote from us in about 2 minutes.
Yeah, I have to say, I did it earlier this week, and I was blown away by just the level of sophistication, but then also the user friendliness. And I know that our teams worked tirelessly to come up with the best solution for many, many months. And I think it really has paid off ultimately, as far as the way that it comes across to the regular agent, right? So I just want to be very transparent to everyone now. Realty Co, what we do is that we find the best partners to provide options for all of our benefits and services. So our commission funding we do in-house, but for all the other services, we partner with another firm that's really going to give you the best of the best. So my next question is going to be about traditional and non-traditional. For our traditional healthcare option, we provide United Healthcare. Actually, it's the United Healthcare affiliate, which really gives us the flexibility to provide 200 to 250 different plans for our agents across the country. Now, there is a caveat with this, and that's United Healthcare is only found in 48 states. The two states they're not is in Massachusetts and New York. So, Tom, can you explain why is that? Is every state its own territory? Does an insurance company have to set up shop individually in each state in order to be viable?
Well, I can't really speak for United Healthcare, but what I can tell you in general is that, it's up to the carrier to work with the state's insurance department to develop file products, and bring products to market. So I really can't speak for why Massachusetts and New York aren't available to United Healthcare. They're certainly available on the exchanges. So United Healthcare participates in a lot of the different marketplaces on the ACA exchanges. I'm not positive they're in New York and Massachusetts, but I know they do offer product, whether it's on the exchange or off the exchange within those states. So, I can't really speak for that.
Got it. So, I guess, can we look at the difference between our option of United Healthcare and our option of Solo? It has been said that the United Healthcare option is a traditional healthcare, uh, traditional in insurance. What do
Yeah.
people mean when they say traditional?
Well, in general, I think again, that, as it relates to individuals, consumers, if you will, consumers are used to hearing traditional insurance, and I think that you would liken that to what's available on the the Affordable Care Act, the ACA, commonly known as Obamacare, or what is also known as off-marketplace exchange programs, which are really the same thing as the ACA. The networks might be a little broader. Rates are pretty much the same depending upon the state. But those are individual health insurance plans that are available to anybody, any willing person that chooses to purchase that, whether it's on the exchange or off the exchange offered by the same carrier. That's what most people consider traditional health insurance.
Got it. And that would also be like a traditional. There's an open enrollment period that you have to abide by certain conditions and regulations. Correct?
Yes, yes. The open enrollment period for the ACA is January 1st. And for a lot of reasons, and for the most part, good reasons for the ACA, in order for it to work, they have to have a specific period of enrollment. So you can really only enroll in the ACA exchanges on January 1st, or if you have a life event, whether if you had a child, if you go through a divorce, you have a job change, that also makes people eligible to switch. But for all intents and purposes, open enrollment for the exchanges is January 1.
Got it. And that's when it ends, or that's when it starts?
That's when it begins, and it would follow through the entire calendar year, and everything resets the following January.
Got it. And I believe there's a lot, like with United Healthcare. Last year, I know it was going from sometime in November through the end of December or middle of December. So
Mhm.
just to have our listeners, file in the back of your mind, if you have that kind of healthcare, to just be open eared, to know that there's some deadlines that are coming up. And our goal here at RoyaltyCo is to keep you informed so that you're not rushing to have to make those decisions in the short term. You can slowly understand how it's all put together and why it does make a big difference. So, Tom, can you tell us why is Solo considered a non-traditional type of plan?
Well, it's non-traditional really on purpose because, like I said at the top of the program, I strongly believe it's this population of self-employed, let's talk real estate agents in particular here, a Realty Co call, uh, where they literally get screwed the most. They are provided with the least amount of options. If you're working for an employer, especially an employer who subsidizes, and many subsidize very strong in terms of what they put in terms of the cost share, what they provide to the employees. That just doesn't happen to the individuals. Now, part of the problem there is that the ACA exchanges need the healthier risks to be on the ACA exchanges so that they balance out, and effectively the younger, healthier people on the exchanges subsidize the older, unhealthier population. That in general is why this takes place. Now, this all started with Obamacare many years ago, but it still is here. So when your audience is thinking about the difference between traditional and non-traditional in the sense of the ACA versus solo, very important to note that solo is different because solo is a form of business insurance. Again, you're a self-employed business owner. You're a 1099, but you should be set up as a business with an EIN number, and we underwrite your business. So your business is what establishes its self-insured program with Solo Health Collective, completely different from the ACA. And Eric, if I may, you and I talked about this a little bit earlier, and I like what you came up with.
I guess this would be a good time for us to kind of walk down the road of more of what solo provides. And I guess that would be it's a healthcare option that really appeals and is directed towards the healthier, the younger per se, that takes good care of themselves. And really, my dad was an entrepreneur. He owned his own company. We only had major medical because we were never sick. Never had to go to the doctor on a regular basis. Nobody was on pharmacy drugs on a long-term basis. So we only went to the doctor when we had to, or for like preventative care with the dentist. But my dad was constantly looking at, oh, how can I cut costs? How can I, run more efficiently, the overall cost of the business and the family. So that's really you're going to find this as a major cost savings for those people that are really looking for, maybe not that full slate of services while they're there, but they're not looking to max out their deductible at every year per se.
Well, yes, to be clear though, I mean, we're as comprehensive as the biggest, best employer in the country. At Solo, we cover everything those employers do. There's no lifetime maximum benefit. There's no annual lifetime benefit. Everything is covered. But when you talk about what's attractive, uh, you know, first of all, everybody should know that we underwrite each business into the plan. So there's literally an underwriting process, meaning that you're providing your demographic information. You're also answering what's called a short form medical underwriting form, where we're asking you, for example, in the last 5 years, have you or any of your family members, if you choose to have them covered on Solo, have they taken any of the following drugs? And we have like 40 drugs listed. And then in the last 5 years, have you had any heart issues, any liver issues, any major medical issues that you have had historically? And if you answer yes to any of these questions, you're nullified from being able to join the collective. We shut down underwriting right there. Furthermore, we see about 60-70% of the people that apply to be on Solo can get through the medical history questionnaire. But then we're also underwriting your business based on your age, gender, and where you live. And this isn't really true of how others take the same approach. They don't take the same approach to underwriting. So the opportunity here with Solo as compared to traditional health plans, as I like to say, is everyone should figure out if they can be underwritten by a provider like Solo Health Collective to become part of a collective of like-minded individuals who are paying attention to their health, who want to build on something that's sustainable, join a program that is more sustainable and more likely to deliver long-term cost savings. It's for the most part, we're saving a lot of money for people annually. So when they join the plan, they're saving monthly, they're saving annually. But the whole idea and the vision of the collective itself is to put into a community or the collective like-minded people that are have health in mind. And we're, under the 3 plans that we have, and I know we'll get into plan design shortly, but I'll emphasize that all preventive care is covered. Uh, we are going to bug you to get your preventive care, all your age and gender appropriate screenings completed. They're covered at 100%. We want you doing that. That's why we cover it at 100%. There's no cost sharing there. So by getting your age and gender appropriate screenings, you're with us for a long time. We're going to detect things early and take care of them early rather than late when they're much more likely to be higher expense claims and frankly, more dangerous in terms of letting your health go.
Right. So, I have to say, having been at RealtyCo now 7 months and being able to offer this, to the entire country, it's been an interesting rollout because we didn't have that great website yet when I first came on board at the end of last year. And I'll be honest, we didn't do a great job of telling the story because I don't think we fully understood the whole story. And real estate agents aren't necessarily the best or quickest to adopt anything new, just to be honest.
I get it.
So I know that I'm really trying to understand and being able to articulate the story in a much better manner now, so that when we come up to open enrollment for other plans, people will be able to come and look at the solo plan. Because I'll be honest, there's been some people that just, they are so excited because they're saving 50% off of the marketplace premiums.
Yeah.
I mean, it's just the savings are unbelievable. Now, there have been other people that my friend lost his health care because he had changed addresses and didn't tell the company. And they were saying we need your we need your premium. Otherwise you'll be canceled. And he sure enough was canceled. Called me on a Friday evening, and he now lives in Florida. And I said, you know what? This is the plan for you. Check it out, explore the option. And we were able to provide him health care at a reasonable number comparatively to what he had before. Mind you, he's over 50. And had another healthcare or had another person on the plan, and they're in Miami. So it's another high ticket place to live. But he was extremely happy. And to know that the plan that is created with Solo, it's one healthcare plan. It's one plan that just has 3 different tiers, and that's based upon your deductible, either 2,500, 5,000, or 10,000. Correct?
You got it. 3 plan designs, all the exact same, with the exception of the deductible that the individual chooses.
Right. And the premium will change based upon those factors. But I mean, I've always been so, you get that one chart, right? That has every healthcare plan that your employer is providing you. And you've got to go down and you have to, well, I like it for this reason. I don't like it for this reason. And you're having to, judge and critique based upon all these things that you don't know if you're going to need or not. I found the Solo to be so easy and user friendly. Everything is on the website. You have your network. So if you're in a different state, or just looking up, the pharmaceuticals, it was so easy. And you can go online and get your quote literally in less than a minute.
Yeah, that's by design. Further on the plan design, Eric, you mentioned 2,500, 5,000, 10,000 deductibles. Those are the individuals. And, we like to say dead simple. We tried to keep this as simple as possible. So another couple more things to know. For a family, whether it's an individual and a spouse or individual and children or both, the family is 2 times that deductible. So it's 2,500, 5,000, so on, right? But then what's key is there's no co-insurance. Most plans, almost every plan you're going to see that is a competitor of ours, whether they're on the exchanges or off the exchanges, will have co-insurance, meaning that you have to hit your deductible, then you pay a portion, usually
Right,
70,
right.
30 or 20% until you're out of pocket another maybe $5,000. Our deductible is your maximum out of pocket. And after that, you're at 100%. The only exception is with some of the higher end drugs. There's going to be a copay on that.
Right. I mean, it's so well thought out, because there's no guessing where. I mean, I had a lot of questions because I just have known from previous um, health insurance plans. So that deductible is your out of cost, your out of pocket at the end of the year. You're not going to spend more than that plus your premium. There might be one or two things out there, but you're paying all of the expenses prior to that.
Yeah.
You just, be organized and keep a file. But I found it to be just so not just user friendly, but knowing that if I switched a plan from one year to the next, it's not like it the value changes, right? It's just what I'm choosing as the deductible, which
Yeah. Yeah.
um, makes it quite simple. Now, I believe you mentioned you don't have an open enrollment, so can you just join any time of the year?
Again, simple is what we're looking for. So yes, and not any time of the year, but the first of the month
Okay.
is the time you can join. We, you know, this is all about service. We position ourselves as white glove service. I like to think we are the highest level of service an individual buyer can get with health insurance today. You'll see that in our support team.
Well, Jason and Allison have just been, I have to say, terrific from day one. I really enjoy working with them.
That's great. And Michael and Allie talk to our members every day, and we'll grow that area of the business as we grow further. But the key is that, and I want to make a couple points that it's really important people know. So you talk about open enrollment, and earlier you talked about, brand identity, and should people be nervous or a little reluctant to join a brand they don't know. One thing I want to make clear is try it, you'll like it. Okay, so there is an element of Solo Health Collective that I can say you can try it, and if you don't like it, you can leave and not have any interruption. So what's key is, since you're a business joining the plan, again, it's a business insurance plan, you're joining Solo. Let's say you're joining for July 1st. Let's say you're on an ACA plan right now, you listen to this podcast, and you decided you need to move because number one, you're probably going to save on rate, and two, maybe you haven't used what you have so far and want to get a PPO instead of an HMO. So hypothetical. So you join Solo Health Collective with a little concern that you're not so sure you're making the right decision. Try it, you'll like it. I think you'll love our support. You'll like the plan. And for whatever reason, if you want to leave Solo, you can cancel at any time. You're in it for the month that you paid for.
Wow.
We hit your credit card or your ACH on the first of the month. So if you joined today for July 1, first of all, you're not being charged until July 1st. You're on the plan for that month. Now, we want you on the plan for the next 5 years, but we're so confident in what we're doing that if you choose to leave, let's say you ride it out, you decide in the month of July, wish I didn't do this, I want to go back to my old plan. That is you lost your business insurance. That is a life event, and you can just very simply rejoin the ACA.
Got it.
Okay. That's an important distinction because, it's not too often that you can try something out that's, as big of an expense item as this is and return it. You can't do that with a car, that's for sure. It happened to me once. But
Well, I love the opportunity too with the flexibility that, sometimes you don't need to sign up for a plan on their terms that they're on their schedule per se. You only need to have insurance for 3 months, but you don't have Cobra or, for whatever circumstance, you can utilize this as that stopgap and really help your health and your business be covered in that short amount of time.
sure. And one thing I would add to that is the way we protect the plan and the collective, its members against adverse selection. In other words, because we have this relatively liberal policy of people can just join, because we're asking these medical questions, we're not buying any medical claims. We can't really join the plan July 1 knowing you have surgery on the 3rd and get on the plan. So that would be disastrous from an underwriting standpoint. So we protect ourselves and the plan members that are in the plan today and future from that by asking the right questions. But it is a place to your point, if you need gap insurance. Now, most real estate agents are in it for the long haul, but we do a lot of business with freelancers, as an example, who might have a permanent job, might have left that permanent job to do a gig, and needed 3 months of insurance for that, and they got a job offer from an employer that offers benefits, so they really only needed us for 3 months. That's fine. That's fine. We welcome that.
That's great. So, I guess as we're talking here and going over all of them, the great values that you don't get with the traditional health insurance company. You know, Tom, it struck me earlier today when we were talking about this, because I guess I was a little confused and a little alarmed at first, knowing that, solo's not for everybody. You've got these looming 5 questions, but really it is think of it as almost like a gated community per se, or, use an example, a New York City co-op, a cooperative apartment building, right? So in a traditional healthcare with employers, there's no, you can't ask any questions of health or whatnot, but it's also, that's not the way they're set up, right? They're set up to have the masses join them so that anybody can join them. So there's more people to shoulder uh, the liability. And if you would liken that to, say, a New York City condominium purchase, anybody can purchase it, just cash. You don't even have to be a citizen, right? You can just go in there and purchase it. But a New York City cooperative has certain rules and restrictions before you can join it. And it's perfectly legal because it's set up to be a collective, a small group of like-minded people.
I like the way you frame that. It's different. And the key distinction is it's business insurance. Your business is establishing the plan solo. And as an individual in the market, whether it's the ACA or just an off-market exchange, it's the individual. That's a business to consumer play.
Right. And so, one of the things I like to say whenever I'm out doing a presentation is I ask how many CEOs are out there, how many heads of marketing, how many heads of business development. And I know people are shy because certainly the true experts and the true professionals know that, yeah, I am the CEO of my own company. The buck stops here and everything runs with me because I am running a massive sales and marketing company myself, right? So that's, I think, one of the mindsets that agents need to, really take on every morning is that, no, they are running not just a team, they're running a massive company, corporation, and it should be treated as such, right? So you're allowed certain opportunities, which what solo is. And with that said, if you don't qualify, don't worry. Yes, we have
Right.
United Healthcare in 48 of the 50 state options, but you now have something in place that we can offer.
Sure. Yeah, we want to have an answer for everybody. And I would tell you that if you can't make it now because of prior medical history and we can't get the underwriter to underwrite your business,
Mm-hmm.
it could very well be next year. It could be 6 months from now. You'll see that the questions are in the last 5 years. There's some other questions that are a little more liberal, but there's a point in time when if we can't underwrite you today, we'll be able to underwrite you down the road. Now, if we can't underwrite you today, we have 2 partnerships. I'm going to talk about one of them, which is a newer one, with a company called Catch.co. Catch.co, we are coexisting with Catch.co on another really large opportunity that we introduced January 1, 25, and have written a lot of business under. But Catch.co is an alternative to solo. What they do is they have partnered with the federal marketplace and all the state exchanges, and they have a special license, if you will, to sell exchange business. So people in, for example, a real estate professional in New York doesn't have to go on New York State of Health to find their ACA plan. They go through Catch.co, and it's the technology Catch.co operates to make this happen. Compared to New York State of Health, it's beyond up to date. It's like Jetsons. It's really, really user friendly. It's pretty cool. And in seconds, they're telling you, uh, Catch.co is what your rates are for all the different plans. Same, so does New York State of Health. But
But it's a little bit more tedious. You have to understand some things before you do it and do lots of scrolling and cross comparing. And um, this is just a really great option that people know that they can trust Realty Health as a major option for them to get health insurance. You know, uh, yes, you can also set up your EIN with us too. But this is I think a game changer because it really uh, solo is a great plan, but if that's not an option, you have two other great opportunities to get healthcare. So
we want to get you covered. I can tell you that if Solo doesn't fit and you're on the Catch.co site and you need help, Solo support is there to help you. That's part of our partnership with that organization that we're happy to help. So we'll answer questions. Our support team is they under the Realty Co health vertical, if you will. Solo's here to help on anything we can to make sure that the people looking through the Realty Co site get good coverage, no matter if it's Solo, United Healthcare, or something on Catch.co.
that's awesome. So the takeaways are: one, every real estate agent, if you're not already, you should have at least an EIN. Or if you do an LLC or S corp, you obviously get an EIN with that. That's going to set you up as a regular business, a separate entity from your social security number. But if you are running a big team, Tom, this is perfect, right? Because the team will be in one EIN, but all of the other members will have their own EIN too. So even though they're part of a big team, they're individually paid through their own EIN that's an S corp or an LLC. They too can get the solo plan, correct?
I would think so. I mean, it sounds like they're operating their own business. It's a business of one. Uh, if they want their family on it, great. You just can't have any W-2 employees on Solo.
Right. So if you happen to have a team that you're two different people, but you're sharing that LLC, both of you can join under that one EIN. So,
Correct.
Thank you, Tom. This has been really, really enlightening. We appreciate your time. And I guess if there's any piece of advice that you would give our real estate agents out there with regards to insurance and where things are headed, any advice?
I would just say that again, and I opened with this. I said it in the middle of the road. I'll say it at the end. This is the group of people that have the least amount of flexibility and options available. Know what your options are. There are plenty of them. Don't listen to others when they say that all there is the ACA. That's not really true anymore. So explore your options, see what's right for you.
And Realty Co is providing those options. And I just have to say, it costs you nothing to explore. You can go to realtyco.com, go under healthcare, and then scroll down past the phone number for United Healthcare. I mean, you can call them too. But really for Solo, just click on it, and then it will take you to the calculator that literally you're putting your birth date, where you live. It's a very quick process. And know that if you don't qualify for that, we're gonna take care of you. Don't worry. We'll have another option that just isn't that section, but it'll be something similar. And always, you can feel free to reach out to me. I'm Eric Zollinger, head of sales of Realty Co. But I will say this: I am not an attorney. I am not an accountant. I am not an insurance broker. So I'm limited in what I can actually say. But I will tell you that Jason and Allison that work for the Healthy Business Group that provide the solo plan, they are fantastic and they are waiting for you to reach out to them. We're going to do some events this summer and fall so that everybody is really prepared when the next regular open enrollment time happens. So again, Tom, thank you so much for coming on. Hopefully I can have you on as a thought leader in season 2 of the regular episode of Agent Brew. We look forward to working with you.
I would love to do that, and I really appreciate the opportunity to speak with you today, Eric.
All right, well, thank you. And I'm Eric Zollinger of Realty Co., reminding you it's a great day for real estate. The Agent Brew podcast is brought to you by Realty Co. Realty Co. is your partner in real estate, bringing you game-changing benefits and services to empower your business. Visit realtyco.com for more information.